Here is your question. In exam, you'll get 9 minutes to prepare this station, but here not too much written, one slide, so 1 minute should be enough.
Okay.
So, yeah. So if you have read and understood, considering it communication skills station, kindly please begin.
Okay. Hello, my name is Dr. Mahmoud. I'm one of the surgical HHO of this hospital. So can I confirm, am I talking to the consultant on call?
Yes, okay, continue.
Okay, doctor, we have a 69 years old lady. Is a day 1 post-op from elective right hemicolectomy, secondary to a cecal tumor. So we have done a liver biopsy, secondary to suspected metastasis. So now she is having persistent tachycardia around 120 beats per minute and hypotension of 90/60 millimeter of mercury. Her temperature is normal. So on post-operative day 1, her HB is dropped from 12 to 10 after receiving 2 units of blood during the surgery. We did some blood test. Her serum creatinine is 116, urea is 16 millimole per liter. We did ECG, which is normal. We did chest X-ray, is also unremarkable. The abdomen is soft and non-tender. We did urine output. That one is 10 to 20 ml per hour in last 8 hours. I checked the fluid chart, which shows is only received about 1,100 ml of normal saline. So now I want to suggestion from you.
Okay. So what's your plan for action?
Okay, so for me, I think according to the fluid chart, the patient didn't receive adequate amount of fluid, as she only received 1100 ml of normal saline. So I will start with the fluid challenge. I will give 250 to 500 ml of normal saline for 15 minutes, and then I will check the urine output again. So if the vitals are not stable, we have to repeat those fluid challenge again, and then we have to continuously monitor the patient.
Okay, what do you think the cause?
I think this is the cause. Maybe the patient didn't receive adequate amount of fluid, or we can also think maybe she might have a bleeding from any side, as the hemoglobin is dropped from 12 to 10. So I have to check other parameter as well. I check ABG while I will drop the phone, and then get back to you.
Okay, so we're starting the fluid challenge. Is that right?
Yes, I will start the
How
fluid
many
challenge.
times you can repeat it?
I can repeat up to 4 times.
Okay, how much you will give?
I will give 250 to 500 ml.
Okay, you tell me the hemoglobin dropped from 12 to 10. Are you think
Yes.
you have bleeding?
Yeah, okay, as the abdomen is soft, flat, we don't see any other sign of bleeding. So, but it could be, and as the, okay, here is not mentioned about the ultrasound. So, okay, we can do an ultrasound of abdomen as well to rule out is there any bleeding. And then I will get back to you.
Mm-hmm.
Do you
Okay,
think
how you monitor this response of this patient when you give the fluid challenge?
Okay, so I have to check again the blood pressure, the pulse, capillary refill, mental state of the patient, and then of course we have to monitor the urine output as well.
Okay, where you will monitor the patient?
So the patient is currently on the ward. So after giving the fluid challenge, if he's not doing well, then we have to transfer the patient to HDU.
Okay, do you think this is the cause of the anastomotic leakage?
Okay, it's too early to say, and as the abdomen is soft, non-tender, is unremarkable, so it could be not. But as we planned for a ultrasound, so that will lead us to get the diagnosis.
Okay, do you need me to come back?
Okay, doctor, I will try to manage the patient. I will give fluid resuscitation. If it's failed, then I will transfer the patient to HDU. Then I will call you back.
Okay, is the patient need the HDU transfer?
Yeah, as I said, if the fluid challenge is failed, then we can transfer the patient to HDU.
Okay, if the HDU it is full, what are you going to speak?
Okay, so I will inform the bed manager. So if it's possible, either to discharge any stable patient, or if it's possible to swap the patient.
Does it require operation now?
Sorry?
Is the patient need require the operation?
No, not now. Maybe after the fluid resuscitation, after the ultrasound, then we can decide. If there is any anastomotic leak, if there is any bleeding inside, then maybe we can think about the operation.
Okay, if this patient need to hemodialysis, what's the indication for hemodialysis?
So if the creatinine is more than 3, if the patient is having acute kidney injury, or like if the GFR is less than 15, and I
If this
forgot.
patient need hemodialysis?
No, for now the patient doesn't need hemodialysis yet. Or if
Why
the potassium is more than 7, then we'll have to think about dialysis.
why does patient have renal function disturbed?
Could be due to the hypovolemia, as the postoperative period fluid was not given properly. That's why.
Acute kidney injury. Yeah.
Or maybe for sepsis, but there is no sign of sepsis yet.
This patient with acute kidney injury.
it's acute kidney injury? So what would be the type of shock this patient is going through?
Okay, so patient might have a hypovolemic shock.
Very good.
And
there
if
is
his
also
anastomotic leak, could be a septic shock.
Yes.
Okay. Who the consultant of this case is?
The surgeon is not mentioned his name.
Maybe in STEM it will be mentioned Mr. Lard
Yes.
or Mr. Mann or something.
Yes, ma'am.
Okay.
Do you have any more questions?
No.
Good. Thank you.
So the time is up.
Yeah, just went when I started
Okay.
taking.